This is just the beginning.
Welcome back to Axios' Vitals Checkup series, in which we'll talk about the most pressing healthcare issues of the day. I'm Caitlin Owens, a healthcare reporter at Axios, and I'm joining you from my home in Washington, D.C. Welcome to our audiences on Facebook, YouTube, Twitter, LinkedIn, and Axios.com. You can join our conversation today on Twitter using @Axios or the hashtag AxiosEvents. Over the next 30 minutes, I'll be joined by healthcare editor Tina Reed, and we'll be talking about how to continue getting more Americans vaccinated against COVID-19, as well as how to maintain momentum around vaccinations heading into the fall with potential booster shots. Our first guest today is the author of Uncontrolled Spread, a new book that's out September 21st. He's also a former FDA commissioner and on the board of Pfizer. Welcome, Dr. Scott Gottlieb.
Thanks a lot. Thanks for having me.
Thanks for coming, Scott. So let's start off by talking about your new book. One of the major themes of the book is that the U.S. healthcare institutions like CDC, the FDA, were very unprepared to deal with a pandemic like this. And we're seeing some of those same complaints, especially with the CDC, continue today as we're trying to deal with Delta. Can you talk about what are some of the root causes of those institutional problems and then what we could do to fix them?
Yeah, look, I think we need to look at public health preparedness through a lens of national security. And if we're thinking of public health and public health preparedness through that orientation, you start to think about how you put in place different kinds of capacities to respond to a crisis of this magnitude. We really didn't have that. I think that there was a perception that CDC had this, that they'd be able to mount a national scale response to a crisis of this magnitude, but it's not the kind of organization that they are. CDC is a high science organization. They do very good, exquisite scientific analyses of outbreaks, but it's a very retrospective mindset in terms of how they gather and analyze information, not a prospective mindset. They don't do horizon scanning. They don't provide partial information, sort of real-time reporting that you need in a crisis to help inform decisions that have to get made in a real-time fashion. And they don't have an operational capacity to actually mount a national response. And the place where this was, I think, the most obvious was around testing. CDC didn't have the capacity to develop and deploy a test at scale. They didn't really have an infrastructure or the resources to turn to contract manufacturers to scale that response, to scale the development of testing. So we didn't have enough tests developed early on. And they didn't have the connections to the lab community beyond just their relationships to the public health labs to actually deploy tests. They had to be able to go into clinical labs and academic labs and get them stood up. And they also had to turn to contract manufacturers that could develop tests that would sit on top of the large high throughput platforms that are in most labs around the country. But CDC doesn't have those connections. They largely just interface with the public health labs. So they were never going to be the right organization to mount this kind of response. We always needed to have an organization with a more operational capability. And the final point here is we sort of realized that when it came to developing a vaccine. What you saw the administration ultimately do was create Operation Warp Speed, which was a marriage between the scientists, the regulators, FDA in particular, and DOD and FEMA. DOD played a very heavy role in helping to organize that response and get the vaccines distributed. So you saw the synergy between a high science organization like FDA and an organization with the lift capacity like the DOD. The same thing needed to happen at the outset in terms of mounting a national response. It didn't. And I think that's why we got so inundated with virus early on and really couldn't keep up with the crisis.
Right. Now, fast forward a little bit to today. Where we are as a country right now, we have these vaccines. They work really well. We're still trying to convince a good sizable chunk of the population to get the vaccine. The Biden administration announced a series of policies yesterday trying to make that happen. But in your opinion, what is the best way to reach some of these holdouts?
Hey, look, I think that continue to chip away at it. I think that it's going to take more bespoke efforts to try to get the people who haven't been vaccinated at this point vaccinated. Some people haven't been vaccinated because it's still difficult for them. It's not convenient. So we have to go into the community, offer vaccine in sites, and at times that is easier for people to access. Some people haven't been vaccinated because they perceive themselves to be less at risk for COVID. And they might be making a rational judgment in terms of their overall risk. I think there you just have a longer consideration period. And I think trying to get the vaccine into the hands of providers and others who can counsel individuals more effectively about the risk benefit of getting vaccinated can help. Some people have skepticism around the vaccines, and I just think getting better information into the hands of individuals and pushing back on some of the misinformation in the marketplace is going to be important. But it's not going to be easy. The sort of easy demand we've worked off initially, people who were lining up to get the vaccines, it was always going to be the case that getting the last 10% of the population, last 15% of the population that you're going to end up getting vaccinated, getting them actually to get their shots in their arms was always going to be much more difficult. The sort of residual demand, if you will, or the last 10% was always going to be much more difficult to vaccinate than the first 40%. And we knew that at the outset. And so we're at that point right now where every vaccine is harder to administer because you're probably trying to entice a consumer who's more reluctant to take the vaccine or finds it less accessible for a variety of reasons.
One other thing with the vaccines is that there's a substantial chunk of people not eligible for them, children. So we're seeing this kind of become a problem as schools try to reopen. We're seeing outbreaks across the country. The number of cases among children is hitting record levels. How do we go forward with this, with keeping schools open, but also keeping kids safe?
Yeah, look, what's happening, I think, right now in some southern states is deeply unfortunate, where you're seeing that the overall level of infection is declining in states like Florida, Arkansas, Louisiana, but where you're seeing case growth is in 5 to 19 kids, school-age kids, because they've reopened schools. In many of those states, they haven't adopted uniform approaches to mitigation in the schools, and you're seeing the virus really, course through that environment. And so even as cases decline in every age category, the one age category where it's continuing to increase is in school-age children. I don't know what we're going to do to abate that because there have been decisions made by some local officials and some state officials not to implement as stringent mitigation as we've done in the past around the schools, trying to keep kids both safe and keep kids in the classroom. In the setting of Delta, which is a much more contagious variant, it may be the case that this becomes very hard to control in schools no matter what we do. But you don't want to go into the school year with one hand tied behind your back. I think that the two most effective approaches to trying to reduce the risk of spread in the classroom is keeping kids in defined social pods. And the literature supports this. When studies have looked at what are the most effective interventions, keeping kids in defined social pods within the schools. So you're not having the entire grade commingling, but you're keeping kids within their classrooms and letting them move around the schoolhouse within their classrooms, and also implementing routine testing of asymptomatic children, ideally twice a week. I think that there's a perception in some political circles, and I'm seeing this on social media, that if you implement routine testing, it's just going to lead to a whole bunch of quarantines because you're going to turn over positive cases and then you're going to end up quarantining entire classes or entire grades. And it's actually quite the opposite in schools that have done this effectively. If you Google test to stay right now, there's a whole movement around designing protocols that actually allow kids to stay in school even after a positive case is turned over, rather than quarantining large cohorts of children. What you do is you just implement serial testing around the exposure. So, for example, if you have a positive case in a classroom, particularly in a classroom where kids were wearing masks, so you know that you're going to probably reduce the risk of transmission through the use of masks, rather than quarantining that whole classroom, you just test them in a serial fashion to make sure that you didn't have an exposure that led to a downstream case. And so you could actually use testing to prevent quarantines. And I think that's a really important point, that the testing could actually not only keep kids safe, but keep kids in the classroom. The reason why districts haven't done it, in my view, there's organizations offering turnkey solutions to the schools. So it's not just a matter of logistics and operationalizing this. The Broad is doing it for New England schools. California built their own lab. There's private companies that are stepping in to offer a turnkey solution to districts. I think the reason why some districts and a lot of districts are choosing not to implement testing, at least to date, I think they're going to have to do it now after the president's recent announcement, but was because I think just the complexity of turning over those positive cases. How do you deal with it? How do you inform parents? Parents are going to get upset. How do you implement follow-up testing to make sure it's not a false positive? So it's just a lot of sort of political lowercase p issues that get surfaced with implementing a testing regime in the schools that I think districts find complex to deal with.
And then looking ahead to the fall, one other big topic that is imminent is boosters. We kind of figured out the vaccine protocol the first time around as we went by necessity because things were moving so fast. Looking ahead, how can we make sure that the booster process goes smoothly?
Well, I think the population, look, it remains to be seen what decisions FDA and CDC ultimately make around boosters, but it seems to be coursing in a direction that boosters are going to be recommended, at least for older individuals, people who are more vulnerable to the virus, either more likely to come into contact with it or more likely to suffer a bad outcome if they do have a breakthrough infection, and people who are further out from their original vaccination. So there's going to be a time element to this probably and a risk element to it, just based on some of the dialogue that we've already seen from CDC and some FDA and HHS officials. And so that scopes in an elderly population, people over the age of 65. I think to try to make sure that you can reach that group, you want to provide access. And that's going to require more than just opening up mass vaccination sites. You're going to have the capacity to go into particularly congregate facilities, nursing homes, other kinds of facilities where older individuals live who have a more difficult time coming into a pharmacy or coming into a site and actually providing the vaccines on site. We did that with the initial rollout of the vaccines around skilled nursing facilities and nursing homes. I think looking to provide that level of coverage and perhaps see how you can broaden it on a sort of state by state basis, depending on what the local needs are, is going to be important to getting as much coverage in that population as possible.
Well, Scott, we're just about out of time, but let me in on one fun thing very quickly. What was your favorite part of your book to write?
That's a really good question. Probably the chapter on national security, how we need to reorient our national security posture and our intelligence agencies to get them more engaged in the public health mission. I think it's controversial. I think it's some novel ground. So hopefully people get to that. It's the last chapter. So hopefully they make it all the way through and get to it.
You saved the best for last. Thanks, Scott. So. Now we're going to kick things over to Tina Reed, Axios' healthcare editor.
Thank you, Caitlin. I'm Tina Reed, and I'm the healthcare editor for Axios. Our final guest is Chief Medical Officer at Walgreens, Dr. Kevin Ban, joining us from Boston, Massachusetts. Welcome, Kevin.
Hi, Tina. Thanks for having me here.
Thanks for being here. I wanted to start our conversation by talking about Walgreens as an employer. Walgreens recently announced it will require team members based in the company's U.S. support offices to be fully vaccinated. We've written quite a bit at Axios about how employers are grappling with different decisions when it comes to COVID and their employees. How did Walgreens come to this decision to require vaccinations for some of its employees?
This is one of those issues that ends up being in some ways really straightforward and in other ways really complex. Collectively as a group, we have followed the science since the beginning of this epidemic. And along with the effectiveness of these vaccines, we've noted the safety. And so collectively as a leadership team, we thought that the right thing to do here was to in fact mandate vaccines. But, Tina, having said that, there's another part of that too, which is, we're a large organization, 9,000 stores across the entire country, over 250,000 people, and we want to meet people where they are. So we think of this more as a process. It will be iterative. To your point, we started with our corporate offices, all of the headquarters. And we'll figure out, we're going to have to muddle our way through this, but we want to make sure that we're responding to the science, but also listening to our team members.
And notably, this mandate doesn't apply to U.S. team members in stores, as you alluded to. Can you talk about how you plan on muddling through on these decisions? Because it has been a challenge for many employers. What are some of the hurdles that you're trying to get through, and how are you making those decisions?
Well, I think the most important thing was that we made a decision to do it. And so Roz Brewer, our CEO, was very clear that we know where we want to go. We're not exactly sure how we're going to get there, but we're going to make it happen. And we thought the most important thing to do was to start with leadership. And then what we'll do is make sure that we are, again, working with our team members. The goal here is important to keep in mind. We want to, number one, protect our team members, protect our customers, and make sure that we're decreasing spread of virus. And so we believe that, vaccine is fundamental, but there are also other things. A fancy way to put it would be non-pharmaceutical mitigation techniques. Fancy way to say, hand hygiene, social distancing, wearing masks, all of these serve us in a way to protect our team members, protect customers, and to stop the spread.
So switching gears to talk about Walgreens as a health company, what's working right now, in your opinion, when it comes to getting Americans vaccinated against COVID-19?
Well, again, this has been another process. There has been a great deal of ambiguity all the way along, and yet we've been able to kind of push through. I think one of the things that matters a great deal is making sure that the vaccine is accessible, that people can be vaccinated, but not only that they can also get information about the vaccine. It can be difficult to really figure out, what are the true facts and where can I get information. We have pharmacists who are embedded in community, highly respected, and they can not only provide information, but also deliver the vaccine. I think for many people, for someone like me, getting the vaccine was an event. The moment I became eligible, I signed up, I got the vaccine. Should boosters be necessary? I'll do the same thing. For other people, it's a journey, it's a process. They are gathering information, and there are little pieces along the way that add to the puzzle that finally encourage them to be vaccinated. So, look, I'm an emergency physician. I spent over 20 years practicing, and I'm used to people making decisions that I may not agree with, but I'm also used to meeting them where they are and making sure that we help keep them safe.
And we have done a lot of reading of the tea leaves when it comes to, figuring out different trends in vaccinations, and particularly who is not getting vaccinated and why. How have the trends been changing recently?
Well, I'll tell you, this has just been one of those things that's been moving all the way through. I'll tell you that it's hard to know exactly what ultimately motivates people to get vaccinated. I think that's a really interesting thing to look at. People are asking whether or not vaccine mandates right now are driving the uptake of vaccine. It's hard to know. People are returning to schools, they're returning to work. They may be looking down the runway and saying, hey, I'd like to travel as the holidays come around and I want to be vaccinated. We also have a very contagious Delta virus. And so it's hard to know what drives it. I would say that in terms of who's getting vaccinated, it's across the board. One thing is true, and that is that we need to be available to those people when it's not immediately accessible. We've done a lot of clinics, over 250,000 in community, but we even have mobile clinics where we drive deeper into places that are underserved. We want to make sure that people have access not only to information, but to the vaccines themselves.
And what have you seen working? I know there's been some very creative ideas about how we can try and keep up the momentum with vaccinations. I know there's been, some have turned to influencers to try and convince people. I know Walgreens actually turned to John Legend earlier this year. What else do you think we need to be doing, or what else have you seen work?
I think it's very much like any complex problem one tries to solve. And that's really been my takeaway, Tina, from this pandemic, which is there's no silver bullet here. There's no one thing that you ought to do. And so you're right. We engaged John Legend, but quite honestly, we also worked through all of our regional leaders, our district managers, because they know who the thought leaders are in community. And so we really wanted to empower not only at a big level, a national level, but really at the local level, because oftentimes it's the leader of a church, or it can be the leader of a not-for-profit in the community. And we've really tried to tap those people to give them voice and to sort of tell their story. People want to know what the story is, and they want to understand exactly how you arrived at the decision to be vaccinated. And I think that's powerful. So meeting people where they are and listening to them and trying to understand what is it that's preventing you, and then addressing that is powerful. It's hard to do across the country, but you can do it locally.
And the big story is obviously boosters now, and we're still waiting to see how that's going to play out. But when I hear this story, I think of the logistics behind it. And it seems like there are probably some really big logistical challenges to making sure everyone who should be getting a booster would get the right booster at the right time. Can you talk about some of those hurdles ahead?
Well, this has been at times a little bit like baptism by fire. We went through the process of standing up a national vaccine program where, instead of having people initially come into our stores, we were going out into those long-term care facilities. And so we have learned a great deal in terms of what we need to do in order to be ready. Now, the federal government hasn't made a pronouncement yet as to who will need a booster and when. What I can tell you is, based on all those lessons learned over the course of the pandemic, we feel really confident that we're ready to deliver on boosters. We'll do that by leveraging really the infrastructure that we already had. We've been at vaccines for over a decade. Of course, the last year has been an important year, and we've been able to improve the customer experience in terms of online experience, and then just really make sure that all the teams are ready. And so we've been doing a lot of training. We've been improving efficiency, doing everything we can to make sure the workflow for people is really clean so that when it's time, they can be vaccinated.
Data released just about a week ago found several national pharmacy companies have had millions of wasted doses of the vaccine. Walgreens had nearly 2.6 million wasted doses. Why is that still happening, and what are you doing to fix that?
Right. So, ever since the beginning of the process of distributing vaccine, we've been really conscious about not trying to waste vaccine. So earlier, when I mentioned that we're working on our effectiveness, our efficiency, our workflows, we're really identifying those problems. You know, Tina, that the supply chain is difficult, especially for the messenger RNA, Pfizer and Moderna. It can be complicated. So we're really looking at those processes and making sure that we're always continuously improving them so that we can waste as little vaccine as possible.
Well, thank you very much for joining us today, Dr. Kevin Ban.
Thanks, Tina.
Now we dive into our Why It Matters segment, where Caitlin and I will touch on key takeaways from our interviews and what we're tracking on the horizon when it comes to getting Americans vaccinated against COVID-19. Hi, Caitlin.
Hey, Tina.
So that was a really interesting interview you just had with Scott Gottlieb a few minutes ago. Can you talk a little bit about what your biggest takeaway was when it comes to getting people off the fence, getting hesitant to actually get the shot?
Well, yeah, so this is obviously a big topic this week with the Biden administration's new list of policy tools they announced to combat the pandemic, which includes new vaccine mandates. So Scott and I didn't talk about the mandates, but I did think it was interesting, as he was talking about that final 10% of the unvaccinated and how we always knew they were going to be hard to reach. I was kind of doing math in my head where I was like, we have way more than that left to go, even just among adults. So it just kind of got me thinking, like, if we knew it was going to be so hard, does that mean that some of these other, 25% or whatever it is of adults that are not vaccinated, how effective could the mandates be? Do they just need a nudge, or, how is this all going to shake out, and how much leeway can we actually make into cracking up what I'm thinking of as the final frontier? What did you think?
That was a really great point. And what I was thinking when I heard this announcement about Biden's mandate, one of the things that's really striking that I think experts are really going to be looking at is the fact that there's not necessarily going to be a testing exemption. And a lot of experts have pointed that out, that that's just a really wide open loophole for people to avoid getting vaccinated. And so it does seem like we've been inching this way in private industry. The Biden administration has been inching toward mandates with, different sectors of the federal workforce. And now it seems like the hammer is really coming down.
Right. It's like we're kind of done with carrots and have moved on to sticks.
Exactly. So I'm curious about your thoughts on boosters. That seems to also be a big storyline that we're going to keep watching. What's the biggest thing on your mind as you talk to Scott and just with some of your reporting on boosters about, what to expect next?
It just seems like the whole thing is kind of a wild card where it's gotten messier and messier with kind of moving timelines. And now we might start with Pfizer if the FDA and the CDC cleared it all. So over the coming weeks, I mean, this is moving. This is a lot of legs. There's going to be a lot of news on this front. But it's kind of like, well, how many hiccups are there going to be? What's this plan actually going to look like a month from now when it's being implemented? Is it going to look the way the Biden administration wanted it to or not? So yeah, I think it's going to be kind of fun to watch it play out.
Yeah, no, I thought it was interesting when Scott Gottlieb was talking about just how this gets rolled out, and with boosters, we're going to see a lot of the same things we saw with the initial rollout, where we have to go to these to nursing homes, to these large venues to try and get a lot of people. When I was talking to Dr. Ban over at Walgreens, he was talking about how these national pharmacy chains really are set up for this kind of logistics. But I do wonder how challenging it's going to be in this environment to make sure people are getting the boosters in the right order, that they're getting the right shot for them. And so I think it remains to be seen how that goes. But they are pretty confident that it would be fairly smooth, at least for some of these national brands.
Yeah, I guess we'll see. No shortage of news in the coming weeks.
Exactly. Well, thank you so much, Caitlin. I really appreciate it.
Thanks, Tina.
And thank you all for joining us this afternoon for another virtual conversation that has made everyone smarter, faster. For more information or to sign up for our Axios Vitals newsletters, visit axios.com/newsletters or visit us on the Axios app. Thank you all for joining, and we'll see you at next month's Vitals Checkup on axios.com.